There is a sobering statistic about the growing need for mental health care in Maine. State health experts say in the past 5 years, the number of psychiatrists has dropped by nearly half, from roughly 200 to just around 100 today.
To help address the coming crisis, Northern Light Acadia Hospital is starting a psychiatric residency program next year. It would be the second program in Maine. A general psychiatry residency program is offered at Maine Medical Center. And as News Center Maine's Vivian Lee shows us, the new program has already drawn several hundred applicants.
Dr. Nadia Mendiola had just finished her residency in psychiatry in her native Texas when she and her husband ended up in Maine on a vacation after a trip to Ireland was canceled at the last minute.
Everyone we met was super friendly. We love the climate, and there's just so much to do outside.
The Bangor area is now home as Dr. Mendiola serves as a child and adolescent psychiatrist at Northern Light Acadia Hospital.
Everyone I work with as well are absolutely invested in what we do here at Acadia, giving the best care that we possibly can.
Acadia is taking a big step towards building a new generation of psychiatrists like Dr. Mendiola. The private hospital is starting a psychiatric residency program in 2024. The program will help fill the decreasing number of practicing psychiatrists in Maine who have retired or will be leaving the profession in a few years.
The growth in demand for our services, we had to do something, and we spent so much time recruiting.
Dr. John Campbell is a senior physician executive at Acadia Hospital. He says more than 500 applicants have applied for 4 residency spots. The program also plans to offer fellowships or training programs in pediatric and geriatric psychiatry, a massive area of need. Kids in crisis continue to be stuck in local emergency rooms because of the lack of providers and treatment beds.
To get to them in the early phases of the illness before it gets too severe. So we have trouble at either end of that. So people end up in the emergency room.
The hospital is banking on its new $50 million expansion as a powerful recruiting tool to retain the newly minted psychiatrists. Acadia's new pediatric inpatient wing with 50 private and much more secure rooms, therapy areas, and more extensive and secure nursing stations was unveiled last month.
We're also going to have the newest pediatric inpatient child psychiatry unit in the nation. I mean, I think that the investment speaks for itself.
Dr. Mendiola is hopeful the teaching hospital's outstanding training and a team dedicated to providing the best care for the state's most vulnerable patients will also be a big selling point.
There is a good, strong likelihood that we'll be able to recruit at least half of our classes to be able to stay in Maine.
The 4-year program is expected to graduate 16 new psychiatrists in 2028. In Bangor, Vivian Lee, News Center, Maine.
More than 100 of the applicants have been invited for interviews.
Next March, fourth-year medical students find out where they'll be matched for their residencies. Those who get to stay at Acadia will begin their residencies in July.